Hi, this is Dr. Dilhan Aspiayo, Dr. D. Wanted to welcome you to our presentation today. I am thrilled to invite you to meet a colleague and a friend of mine for many years, Dr. William Hudson. He is a certified rehab counselor. He is also the former associate dean and associate professor in the School of Allied Health Sciences at Florida A&M University in Tallahassee. He's semi-retired, but I can guarantee you he's still pretty busy in the field doing a lot with the Florida Rehab Association and other endeavors. He received his bachelor's degree in special ed and a master's degree in rehab counseling, and he also has a doctorate degree in rehabilitation services, all from FSU. His specialty areas are community transition, specific learning disabilities, traumatic brain injury, individual and family and group counseling. He also coordinated the Rehabilitation Services Management Concentration Division of Healthcare Management at FAMU. He has more than 33 years of experience in the field of both rehab and higher ed. He has more than 20 years as a post-secondary education administrator. He's authored more than 38 articles, which focus on research completed in areas of incarcerated juveniles with learning disabilities, retention and progression of first-time and second-year college students, and the development and effectiveness of an early warning alert system, as well as the provision of health-related services to rural elderly and death and dying. His continued research interests have been the effects of body biases of health professionals in the provision of services. So without further ado, I would love to welcome you, introduce you, Dr. Hudson. Thank you for joining the University of South Florida. Thank you for joining the Department of Child and Family Studies Rehabilitation and Mental Health Counseling Program, and we look forward to your presentation.
All right. Thank you for that wonderful introduction. Good morning, or is it afternoon? I believe it is afternoon. Um, Let me give you an overview of what I'm going to try to do today. First of all, I'm going to talk a little bit, maybe 15, 20 minutes about the results of my research, my recent research. Then spend maybe 1 or 2 minutes talking about the survey that you completed prior to this presentation. And lastly, spend maybe 15, 20 minutes talking about change and how there can be a change in racism based on my research and based on some of the articles that I have read in regard to that uh, type of information. But before I get started, I think I would be remiss if I did not at least talk about some of the recent incidents that have happened here in the United States. The most recent being the shooting yesterday in Colorado. Uh, it appears that America is in a transition, and I think this transition revolves around uh, caring about each other. We are all in a field that addresses the issue of caring for one another and caring for those that are disabled or with a disability. And we, as professionals, need to make a decision. Are we going to be available, or are we going to be able to provide services to individuals that we feel are not deserving of such services? That is part of what my research took a look at. Um, what I wanted to talk about to begin this presentation is about the status of America and how racism once again has reared its ugly head. Um, when we talk about racism, we take a look back at what happened to uh, George Floyd and how his death has spread across the United States as well as across the world. And what really has happened is it has shown a side of us that we have kept hidden for the past 400 years in regard to African Americans and in particular to minorities in general. We need to deal with this issue. Uh, what is America going to do about this issue? Are we going to just brush it aside? Were we embarrassed enough about this incident that we can now take a look at it honestly and make some changes? So having said that, what I would like to do now is talk a little bit about my research and take a look at some of the results of that research. 2020 was a year of reckoning. Societal changes have been in limbo for a while in regard to racism. Uh, we need to at least take a look at whether or not America was surprised about what happened to George Floyd, or was we simply embarrassed by it? There has been numerous studies on racism. As a matter of fact, as a result of the death of George Floyd, uh, additional research have been implemented, one of which I will make reference to as we go through this presentation. But before I get to that part, I wanted to go through some terminology that you will need to know in regard to being able to address some of the issues that I am going to discuss. The first term is called explicit. Explicit biases is a learned bias. It happens usually from society, from our family, or from friends. A lot of times when we are dealing with explicit biases, it is applied unconsciously. It affects how we react to people. It also affects how we provide services to people, which is one of the activities that I wanted to take a look at. I have been collecting data utilizing a body bias inventory that was originated at the University of South Carolina in their freshman year experience program. I used this body bias inventory while I was working at Morehead State University in campus. Students to follow up with sophomore students. When I came to Florida A&M University, I decided that it would be appropriate to use that body bias inventory at the junior and senior level. I wanted to take a look at how those students would in fact acclimate themselves to providing services to individuals with disability, and if their biases would affect their ability to honestly and completely provide needed services on a very basic level. So I decided to utilize that biases over a 5-year period. So the data that I will be reported on is over that 5-year period. The second term I wanted to discuss is called implicit biases. This is the most common type of biases. It's an internal influence on individuals. Is usually based on the environment. It's also unconsciously applied. Uh, as I go through the research, you will notice that most of the biases that's discussed is implicit biases, and it details how that is applied and in what circumstances that is applied. I also wanted to talk to you for a moment about biases themselves, how biases influence the way we interact with each other, the way we provide individual information to each other, how we basically relate to each other. Now, in regard to implicit biases, I'm going to give you an email address that you can use. And when you go to this site, you will notice that there are several tests that you can take to determine what your implicit biases are. So if you have a pen available, I want you to write down this website. The website is implicit.harvard.edu/implicit. So if you will, go to that site and take those series of tests to determine exactly what your biases are in regard to your relationship with others. While you consider those terms, I want to talk briefly about the survey that you took before uh, this presentation. What I am going to be looking for as a result of that survey will be inconsistencies. I'll take a look at whether or not there are contradictions within the survey, and then I will take a look at all of the surveys to determine if there is some type of group dynamics that's going on within the group that replied to the survey. I will email my results back to Ms. Davis, and she can share that with the participants in this uh, presentation. Ms. Davis, if you will, please post the first chart that I sent to you.
Sure. Okay.
Okay.
Oh, sorry. Hold on. I'm sorry.
Okay.
Let's see.
Well, this first chart, it deals with perceptions of biases, uh, and it also gives you an overview of the types of viruses that the students in the program related to me. Now, the students that I was involved in my research were students in what is called RCS 4610. That's a supervision and coordination class that taught uh, over the 5-year period. And the class involved students that were in majors such as cardiopulmonary science, health informatics and information management, healthcare management, pre-occupational therapy, and pre-physical therapy. The students that were involved in the BBI were students that were on the verge of graduating and were involved in either applying to graduate school or were involved in attempting to gain employment. Those students that graduated from the rehab services management program went into such areas as rehabilitation technicians. They went into areas such as community service coordinators and community service managers. So they were involved in the provision of services to individuals with disabilities. And what you see in this chart is a breakdown of the number of biases based on the type of biases that were exhibited by the students within the class. Over a 5-year period, I did over 1,200 surveys of the students. Actually, I did more. I did more than 1,300, but there were students enrolled in the class, and you know how this happens. Students that enrolled in the class that were underclassmen, sophomores, and they used this class as a filler. Uh, and so they completed the inventory, and I had to go through and eliminate those students that did so. In addition to that, there were a number of students that incorrectly filled out the inventory, and I eliminated those as well, which left me a number of about 1,250 students. I'm going to go through the breakdown. The first breakdown was sexual orientation. There were 58 students that reported that they had a bias against individuals that had a certain sexual orientation. 258 biases were noted for gender. Now, I didn't investigate whether or not this was because of the sexual orientation or because there was an affinity against a certain gender. Next was disability. And I was especially concerned about this because there were 81 students that expressed biases against an individual with a disability. And for someone that's in a major that would provide services to individuals with disability, this was of particular concern to me. I did discuss this bias with those 81 students and was able to at least get some basic idea or relieve my concerns about their ability to work with those types of individuals. 46 students indicated that they had a bias against religion. They didn't indicate which type of religion they had a bias against. There were a number of students that stated that they were not religious and that was the basis for their bias. The number under cultural and ethnicity, the last bias, because this was at a historically black college and university, so you would think that cultural and ethnicity would not have been play as major a role in the results of biases as it did. So this just indicated to me that further research is needed in regard to how the students interpreted biases and whether or not they understood how biases are applied in certain circumstances. Body image was the last bias that was examined, and amazingly, there were a number of students that really had an affinity to dislike people of certain size. They indicated that obese individuals concerned them, that they felt that individuals who were obese lacked discipline, and without discipline, no matter what they would try to do, they would not be successful. And so there was a discussion about that. And unfortunately, uh, the opinion of those individuals did not change. This chart also do not provide the biases based on fear, the biases based on anger, biases based on guilt, and biases based on a misunderstanding. Okay, I'm going to go to chart number 2 now. This chart indicates how the BBI distributed the biases by major. The reason I used this type of information was to see how many participants in the study felt that their major was one of the reasons why they felt their bias, or their bias would hinder them from being successful in their major because it would limit their ability to provide adequate service. This was particularly important for those students who wanted to go on to graduate school in occupational therapy or the DPT graduate program. And as you can see, from the participation, there were 24 students from the Division of Cardiopulmonary Science. There were 66 students from Healthcare Management. Of those 24 students in cardiopulmonary science, only 19 was included in the study. Of the 66 that was in the healthcare management program, only 54 was included in the study. Of the 72 students in health informatics and information management, only 52 were included in this study. Health science, PT, pre-OT, there was 522 students, participants, and only 484 was included in this study. The largest group was the pre-PT students. Of the 681 participants, only 641 was included in this study. Of the sample size, 87% of the students were African Americans, 7% was white, and then 6% was a combination of Asian, Hispanic, Puerto Rican, Nigerian, Haitians, and not specified. There was a few of the students that did not wish to specify their race. 60% of the participants were female, 40% was male. 60% of the participants were seniors, 40% were juniors. Recognizing biases in a classroom setting is a common experience for minority post-secondary students, especially those attending an HBCU, and in some cases, those attending a PWI, predominantly white institution. Myself, having completed my degrees at a PWI, there is occasion when biases are very prevalent, and it's difficult at times for individuals to recognize when a bias is being applied. Sometimes it's from personal feelings. Sometimes it can be from personal beliefs. Sometimes it can be from involvement or association with others of a particular group. Research have shown us that incidents of biases often occur overtly and at times covertly uh, because of prejudice, discrimination, or simply stereotyping. This can result in the masking of the true intent of the bias. Oftentimes, the recipient of the biases ignores it. Sometimes they confront it, sometimes they don't recognize it, and sometimes it is misinterpreted, resulting in inappropriate response to biases. A lot of times biases affect the way we see each other. And it's very important that when you're dealing with individuals with disability, that you examine your biases to determine if you're going to be capable of providing adequate services to those individuals. Going back to what I said earlier about uh, the shootings in Colorado, uh, it has been mentioned that most of the time the shooters that uh, participate in such activities for mental illness. And I don't think that's the case a lot of time. I think that it is not someone with a mental illness, and it is not someone that's just having a bad day. I think we need to examine the reason why these people perform such terrible acts. And I'm afraid that our profession will be the one that will have to deal with these types of individuals. The question that we must ask ourselves is, Will I be able to do it? Will you be able to sit in the same room with someone that's uh, committed such an act and provide them with adequate services? That is one of the reasons why I gave you the website, so that you can go and take those tests to determine if you have a bias for any type of disability, whether that is a mental illness or a physical or emotional disability. It is very important that you understand your ability to provide services to individuals that may have committed such horrible acts. Okay, Ms. Davis, if you will, go back to the survey that the participants, uh, yes. Uh, what I will do with this is, as I have stated earlier, I will examine this. Uh, there are underlying uh, reasons for the questions that are on the survey. Uh, it's really a twofold type of activity. I will take the answers that you have provided and do a litany of examination based on some previous data that I have accumulated based on a national survey to see just where you guys rank in that survey and provide feedback to you. Okay, what I would like to do now is talk a little bit about racism and how biases can affect racism. And what I would like to do is talk about strategies for change and how change can affect racism, especially change in the biases that we have. We all have biases, whether we realize it or not. We have biases, and I really hope that by taking this survey, you were made aware of some of the items or some of the biases that you may have. That website that I gave you will go into more detail, as well as provide some indication as to some of the things that you can do to remedy the biases that you may have. So let's start with the 10 steps that we can take to implement change. The first step is, as I have stated, identify your biases. Take the association test that I referred you to the website. Take that test. They will provide you with a summary. That summary will give you an indication of where your biases lie and hopefully activities that you can take to remedy those biases. The second step, pay attention to language. Be mindful of what you say and how you say it, especially to clients that you may have in the future or to each other. We all belong to a group of individuals. As graduate students, I'm quite sure there is a group dynamics that happens within all of the students in the program. What is that group dynamic? How does the group dynamic work? Do you fit into the group dynamics? Who is the leader of the group dynamics? All of those types of questions you need to ask yourself. But it's also very important that you are mindful how you talk to others. The third step, question your thinking and challenge your assumptions. Flip the script. Put yourself in someone else's shoes. Would you draw the same conclusion if the scenario involved a different gender or race? A lot of times we make assumptions about situations without really having all of the information. And with there being so much misinformation out there today, it's very difficult to make a decision about others. because we don't know if we have all the facts or if the facts that we have are accurate. So it's very important that you challenge your assumption before uh, getting involved with a different situation or a given situation. Make friends. If you don't have friends that are culturally diverse, you should at least make the attempt to seek diversity in your friendships and interaction with others. I don't know if there are a good diverse group within the graduate program. I hope that there is. If you're not in a diverse group, then I would suggest you do some volunteer work at organizations that work with people that are not in your circle, that are not a friend or an acquaintance, because it is important, especially in our profession, that you have a well-rounded perception of others. When I was in the doctoral program, one of my pet peeves was I didn't like individuals that abused children. I didn't like pedophiles. And unfortunately, my major professor knew this. And every opportunity that he had, he would put me in a situation where I would have to be around these types of individuals. He wanted me to see that regardless of my bias, I needed to be able to provide services to this group of individuals. And it worked. I was able to do it. It surprised me, but I was able to do that. Fifth step is to speak out. Hold yourself and others accountable when unconscious biases surface. This is very important. If you do not speak out, you are condoning someone's biases. And it's so easy to just be quiet. You don't want to get involved. You know, that's someone else's opinion. They are entitled to their own opinion. But when they're in your presence, it's not just their opinion. In the survey, there's a question that asks, association brings on a simulation. That simply implies that if you associate with these type of individuals, sooner or later you'll start to believe in the same types of biases that they do. And you subconsciously own those types of biases. So it's very important that you speak out. Step number 6, don't be defensive. Just listen. The use of the words like discrimination, oppression, racism, heterosexism, male or white privilege are not personal criticisms. These are things that must be dealt with, that must be discussed. Far too long, we have avoided these terms in regard to discussing societal problems that exist within America. Far too long, we put up smoke screens to avoid discussing these terms. We can no longer afford to do that. We are at a very crucial point in our society where we must examine these terms. We have to at least own up to the fact that they exist. There are so many people that can't do that. They are either afraid, they fear discussing it because something may come out or something may be said that may offend someone else, or they may be offended. As a matter of fact, some people are even offended when you talk about these terms now, and they refuse to talk about it. Are we that weak that terminology keeps us from being honest with each other? Item 7 or step 7, avoid generalizations. Catch yourself when you use them and ask yourself if the statement was true. One of the questions on the survey asked, do you believe that there are good people in all races? That was a designed question to see just how many of you honestly would report that you thought there were good people in all races. Do you know any good people in another race? Do you have any black friends? Or do you refer to them as your black friends? Or do you refer to them as someone you know? I know the black person that works at my office. I know the black person that's in my class. Is that truly an indication of your knowing someone from a different race? Have you ever spoken to them? You ever asked them, how's their day going? Did they pass uh, an exam, or did they do well on an exam? Don't take for granted that you know someone of a different culture simply because you speak to them or simply because you see them every day. You don't know them. Make an effort to get to know them. That's part of being able to provide services to individuals. We all have pet peeves. The problem is we may not know what they are. This These types of association tests will hopefully uh, provide you with information that will help you to identify what your biases are. Step number 8, use visualizations. Imagine positive images of a group you tend to have biases about or against. Some of you may not even know you have a bias against a certain group. You hear others talk about that group, and you just take for granted that that's the way those people are. Matter of fact, that's what you call them, those people. And it doesn't have to be someone from a different race. It could be someone within your own race. It may be someone in a different class. They may be poor. They may be from a specific area. And remarks are made about them, and you are silent. You don't say anything. You don't comment. You have an option here. You either speak up to let the person know that you do not agree with that visualization of that group or that individual, or you keep quiet, or you lose a friend. There are some things that, as a society, we have to be able to discuss. Guns is going to be one of them, even more prevalent now than ever before. I have 2 or 3 friends that I don't want to have a gun. You may have 2 or 3 friends that you feel the same way about. So do we need to make some changes to the way we address how we deal with guns, how we deal with mental illness, how we deal with racism? These are the type of things that we have to work on. We have to visualize how what we say and what we do affect others. And if what we do in regard to providing services to others affects their life or their quality of life, because that's why we're in this profession. We're in this profession to change the quality of life for individuals with disabilities, individuals with mental illness, individuals with emotional issues. Step number 9, listen to someone else's story. Exercise empathy. We are trained to provide empathy, not sympathy. A lot of times the two get confused. We feel sympathetic to someone that's down and out on their luck. But when it comes down to providing services, does that sympathy transform into empathy? Do we have enough courage or simply the ability to provide empathy to others? Sure, while you're in the graduate programs or the doctoral program, you are trained to provide empathy. When it's going to be quite differently when you go out into the field. There are going to be people that will allow you to be empathetic towards them. But what happens when you run into an aggressive person who do not want your empathy, who do not want your sympathy, who is totally aggressive towards you? Will you be able to deal with that individual? Of course, there are going to be people that will, of course, not be, I guess, what you would call your cup of tea. There are going to be individuals that they're not going to like you simply by you being there, by you being willing to provide services to them. They're not going to like you because of your race. They're not going to like you because of your gender, the color of your hair, your height, your weight. All of these things are going to come into play. Will you be able to work with that individual? Race a lot of times come into play when you're dealing with someone coming from a different race or coming from a different class of individual. It's very important that you look at that person's story. Put yourself in that person's shoes. Are you able to deal with some of the things that they are having to deal with? And they may appear to have a mental illness. But once you start to talk to them, you discover that it is not a mental illness. It's something totally different. They are not willing or able to adjust to the way society is changing. And a lot of times I believe that's what's happening with these shooters. They feel left out. They feel that no one understands them. They feel that they want to get attention from someone. They want their 15-minute of fame. And the only way to do that is to draw attention to themselves. And I would be willing to say that once we examine these individuals, we don't need to worry about, why they did this. It will become apparent once we have a chance to discuss it with them and be able to provide services to them. And the last step, and this is the most crucial step, I believe, is to raise your children to embrace diversity and equity. The only result of that will be a better world for them. What I would like to do now is talk briefly about change. and then maybe spend a few minutes uh, taking a couple of questions from the participants. Change is never easy. Change is good, but it is often feared. Change can be proactive, which is anticipated, or reactive, which is a response. Usually, a reaction is to an event or something that happened in our environment. Change can be anticipated, but a lot of times it is avoided. Societal change can be revolutionary, which occurs in a short period of time, or it can be evolutionary, which takes a longer period of time. It also involved uh, personal growth and personal change by an individual. A concerted effort for change must be made. We are at a crucial point in our history where we have to make change. We have to deal with the issue of biases, which in turn affects racism. There's no place for racism in our country. We have tried to avoid it over the years and to no avail. It keeps coming back. Are we going to deal with this once and for all and make the necessary change that's required of all of us? Or are we too embarrassed to even discuss it? Are we afraid that something will come out? We'll say something that would hurt someone else's feelings or let someone else know that we are weak in a certain area. The time for self-awareness is now. We're either going to have to change and deal with racism, or we're not going to be able to survive as a society. So it's very important that we do that. One last thing I wanted to say is that in that RCS 4610 class, I do a number of things involving group dynamics, because one of the things that I want students to learn was how to get along in a group, how to produce something in a group, have everyone agree to it, and be successful at completing it. Now, a lot of times group dynamics involve different types of personalities. As you progress in your program and you go out into the world to provide services, you're going to have to work in what is called an interdisciplinary team. That team must work together to provide adequate services to everyone. Are you going to be able to accomplish that? You begin by taking that implicit association test. This will give you the information you need to make some decisions about the biases that you may have and how to address uh, working on those biases in the hope of making change. Okay, that's all I want to discuss. If you have any questions, please feel free to ask them at this time.
Jeff had asked at the beginning, what guidance would you have for mental health professionals who do have biases? I believe that was before you went through all of your steps, so I believe that that was answered. But Jeff, do you have any follow-up question for that?
Hi. I think you laid that out very well. I did have a question on one of those points you were making about mental illness.
Right.
And sort of bringing into question, is it mental illness or is it something else, a person's inability to adjust? Could you expand on that just a little?
Sure. Uh, and if you've been watching the news report, one of the first things that they go to is whether or not the individual has a mental illness. And it puts us sort of on the defensive because most of the time we're the profession that deal with those types of individuals. I feel that a lot of times before we make a judgment about it being a mental illness, that we need to wait and get more information on the act. You know, what precipitated the act? Why the population that they selected? You know, this guy went into a grocery store. You know, it to me, it changes my impression about going to Walmart because it appears that where there's a large people that congregate, it attracts these types of individuals. What I would prefer to do is if you want to deal with the mental illness, especially if you have a bias against them, you would want to take that implicit association test. There are a series of 4 of them. I would in fact recommend giving those to any particular client that you may have. Because a lot of time, if they have a bias against you, they're not going to be honest to you. So you're working from a perspective that is a disadvantage for you. You can't get at the true meaning, the true cause of why this individual responded the way that he did, because he's not being honest with you. He's not being upfront. He has his own pet peeves, and it may be you. So I would recommend that we instead of recommending that or suggesting that the individual has a mental illness, taking a closer look at what precipitated the action and how the action can be explained in regard not only from a criminal aspect, but from a mental health aspect. I would like to get more mental health people involved in the diagnosis of those types of individuals from the beginning, not just have someone tell us they believe it's a mental illness issue, but to have a mental health professional there. I think every police department need a mental health specialist. I think when there's something like this that's occurring, that that person need to accompany the police, because if they do not get there in time, there are going to be the after effect of such shootings. A lot of times people need to be assisted on the spot because uh, they're going to have a lot of issues dealing with seeing someone killed or seeing a dead body. So to me, it's important that the mental health professional is on the spot. I don't know if that answers your question. It may be a roundabout way of answering it, but yes, I believe that you need to have the knowledge of the biases that one can have, not only your own personal biases, but biases of the clients that you will be dealing with in order to be able to sufficiently uh, provide services to them.
Yes, thank you.
Okay.
Thank you. And for all of the participants, if you have a question or comment, feel free to either raise your hand or type it into the chat. We have a couple more minutes, and I'm sure that some of you have questions, so don't be shy. And while we wait for it, Dr. Hudson, I just want to thank you again for taking the time. That was a really well thought out presentation, and I think it will give our students and myself a lot to think about as we move forward.
It also gives them an additional resource. Uh, you can provide them with my email address, and if there's any question that they come up with after this presentation, they can always email me and I'll respond to it. Especially when it comes down to group dynamics, how important that is in regard to training of counselors and professionals within the rehabilitation, and mental health field. We must be able to, if we can't get along with each other, how can we expect to get along with our client?
That's right. Did you come away from teaching the group dynamics classes with any tips as far as cohort cohesion and things like that?
Within every group, there's a leader, there's a procrastinator, and there's also someone that would do everything within their power to uh, keep you from completing a task. So those are the three personalities you need to look out for in any group, those three individuals.
Okay, that's interesting. Dr. Dillahunt just typed in the chat. Can you talk a little bit more about clients that you have seen that have a triple minority status, disability, race, gender, etc.?
I did some studies in my younger days on students with learning disabilities that were incarcerated. And one of the results of that research was that most of the time, those individuals didn't start out with a learning disability. It was a learned disability. That is, they discovered at an early age that they could get out of doing academics if they acted a certain way. And so by acting that certain way, they were able to get out of schoolwork, get out of homework, spend most of their time in the principal's office, and eventually not having to go to school at all. So they turn out to be a juvenile delinquent from that learned behavior, which was unfortunate, but that was what their lives turned out to be.
Thank you.
Okay.
And Dr. Dillahunt also asked how we as administrators and faculty can do a better job recruiting diversity within our programs.
One thing is your outreach. In the school that I am in, we have a recruitment coordinator, and that recruitment coordinator goes out to the PWIs, make contact with them, talk to them about our occupational therapy program and our physical therapy program, and invite them to come out and visit our facility. A lot of times, just by making one initial contact, maybe at an HBCU, maybe at a predominantly Black high school, you can initiate a new avenue for minorities to attend your facility or attend your university. You now have a contact at an HBCU. Utilize that. If you have openings in your graduate program, send them to my office. I'll forward them to the dean. She will give them to our recruiter, and I am certain that you will get some applicants from our university.
Thank you. That's very generous of you. Thank you. We will do that. Well, I want to be aware of everyone's time. Are there any more questions? Oh, Dr. Chu, the director of our program, asked how to be an unbiased researcher.
Oh, that's a difficult one. I have tried my best to be one, but I have found that there are times when even my research or my review of data, I try to get an outside person to take a look at it. A lot of times when you publish or attempt to publish, the peer reviewed process tend to work very well. I also have an in-house person that I respect that I'll go to and have them take a look at my results take a look at my data. A lot of time data sets can be confusing. They can reveal one thing in one circumstance and something different in another circumstance. So I'm afraid I can't answer that question. It's difficult. As a researcher herself, she probably can relate to my difficulties in doing that myself.
Okay, thank you.
Yes, thank you very much for joining us today. It's always a pleasure to see you, Bill, Dr.
Okay.
Hudson. And anytime we can support you in your program, please feel free to reach out to us. Have a great day, and thank you so
All
much
right,
for your
you
time
too.
and your energy.
Okay, you have a good day too. Oh, come on.